No, this, oh, well, yeah.
Now it is? Okay. Sorry. For some reason it paused me. So, okay. This week we're going to be talking about infants, toddlers, and preschoolers. So, chapter 31, 32, and 33. Okay. So, there is a ton of growing that's going on during this time period. So, typically during the first 6 weeks, um, it's going to be about 5 to 7 ounces per week of weight gain. The goal is by 6 months of age for infants to have doubled their birth weight, and then they'll triple their weight by a year of age. Okay. They're growing about 1 inch a year for the first 6 months. So there's tons of growing happening. Your central nervous system is the fastest growing system during growth and development in infancy. So obviously, if there's anything that's affecting this growth and development, kids can become really delayed. So if they're not getting a good amount of breast milk or formula, then they can become, failure to thrive kids. And then a lot of times they're going to have effects on their development. They're going to have more delayed development. Okay. The growth pattern happens in spurts. So they're going to have a huge jump up and then it might kind of level off for a second and then a huge jump up. Okay. So it's not going to be a real steady, gradual growth pattern. Okay. So if they don't have a loving environment, if, like I said, they're not being fed, all of that can affect their growth and development. So the maturation of systems. So as they're growing, their heart rate slows down, their respiratory rate slows down. They become anemic around 3 to 6 months of age because that fetal hemoglobin is starting to kind of dwindle off that they had in utero. Okay. So that's slowing as well. Their head growth is very rapid for the first 6 months, and then that kind of levels off as well. Their posterior fontanelle, so that's the back soft spot, that closes typically around 6 to 8 weeks of age after delivery. And then the anterior fontanelle, so the front soft spot, that is closer to a year or even a year and a half. Okay. They're also going to start having better auditory, so better hearing, and also better visual sensation as well with each week, with each month, even in infancy. Their immune system is going to start taking over. That typically happens around 3 to 6 months as well. They're kind of getting further away from birth, so further away from the protections of the mother. If mom is breastfeeding, then they typically continue to have adaptive immunity with mom's breast milk. So they're getting some of those antibodies from mom's breast milk. So their coverage for their immune system is a little bit more profound for longer periods of time. Okay. But by 9 months, they're totally on their own for their immunity. IgA is an immune globulin that protects the GI tract. So that starts to take over at that 9 month range. The vernix caseosa, you guys probably learned about this in maternity. That's kind of that cheesy gunk that's on babes after they're born. So that helps to protect the skin, not only in utero, but then shortly after when they're born from infections through as they're passing through the birth canal. Okay. And then the coverage that the baby has depends on what type of antibodies moms have while they're pregnant. Okay. So if mom isn't immune to something like rubella or measles, that sometimes happens that after people get pregnant, then they do some antibody testing, and parents don't have coverage for measles or rubella or something like that, then that baby is also not going to have those antibodies because mom does not have the antibodies to protect them. Okay. So at birth, babies cannot regulate their temperatures very well. So they need to quickly be dried off and then placed under like a heat lamp for a period of time, or, skin to skin to help regulate their temperature. As they get older, they start to gain more adipose tissue or fatty tissue, and that helps them to protect against losing that heat. Okay. Babies will shiver and can shiver from being cold, but they do not sweat for quite a period of time. So babies can get overheated for very easily. So babies who are less than 6 months, especially in summertime, should not be outside for lengthy periods of time when it's really hot because they can get overheated much easier than we as adults or older kids can. Okay. The body fluid shift happens from birth to obviously a lot of water to then the extracellular fluid. Okay. So then this is predisposing these infants to dehydration a lot more quickly than the older infants or even toddlers. Okay. And each week and each month, they begin regulating their temperatures better. On to fine motor development. The handout is over fine motor development for this week. So prehension is grasping objects. So just a whole hand grasp, not super coordinated, kind of just happen to grab. That happens about 2 to 3 months. The palmar grasp, where it's more coordinated and they can close and hold it in their palm, that's going to be happening more like 4 to 6 months. Okay. Transferring objects from one hand to the other is going to be 7 months of age on average. These are all averages. So these are going to be the answers for like quizzes, tests, things like that. But you have to just know that every kiddo does this at a little bit of a different pace, and there's a range on all of these things in actual practice. Okay. These are kind of at the latest times that kids should be doing this. The pincer grasp, so that's the really fine where they're just using their pointer and their thumb to grab objects. Like you can see this little kiddo grabbing the block. So that's going to be about 10 months. What is also happening about 10 months? They're getting smaller pieces of food and feeding themselves, like those little puffs or things like that. So that's a good time to know that babies should be able to tolerate smaller bits of soft foods to be able to pick those up and put them to their mouth. Taking items out of a container, that usually happens around 11 months, building a tower of 2 blocks around a year. Okay. All right. So I just went over these. What age is the palmar grasp?
2 to 3 months.
Uh-huh. What about transferring objects between hands?
11 months to a year.
7 months. Good.
Oh, 7 months. Sorry.
Yep. Nope, you're fine. Pincer grasp.
10 months.
10 months.
10.
Good. What about building a tower of 2 blocks?
1 year.
1 year.
Yeah. And then what about taking things out of a container?
11 months.
Yep. Good. Perfect. All right. Gross motor development. So fine motor is like, coloring and stringing beads for older kids. Things like that. So finger fine motor. Okay. Think about that. Smaller movements. Gross motor is going to be big body movements. So walking, rolling over, sitting up, raising our head. All of that's going to be gross motor. Okay. So head control, that usually happens around 3 to 4 months of age. Babies should have good head control. They should no longer, if you lift their arms up, they should not continue to let their head just kind of fall back. As they get closer to 3 to 4 months, this is maybe 2-month-old baby, 2 to 3-month-old baby, and then this is probably closer to 4 months. So you can start to see that, they're holding their head in line with their body as they're sitting up. So they're getting good head control. Rolling over, usually by age 5 months, they're going from their belly to their back. And then by 6 months, they're going back to belly. Okay. Tummy time, that's always encouraged to help. It helps with head control. It also helps them to learn to figure out how to roll over. So just be encouraging parents to do that as often as possible. Sitting independently, so not like, tripoding, you know what I mean by that? So they have their hands out in front of them to kind of help them sit up. So sitting totally straight up by 8 months of age. Moving from prone, so belly, laying down, to sitting position, that's by 10 months of age. Okay, so usually cephalocaudal direction. So usually starts with head and goes to the body. Okay, that's usually the typical pattern of development, especially with gross motor. Crawling can happen between 6 to 7 months. Creeping, which that means kind of walking along things, like walking along the wall or a couch. That usually starts around 9 months. Okay, walking with assistance, you holding their one hand and then kind of walking next to you or holding both hands. That's usually at the latest 11 months. Okay, and then walking alone by a year. Okay, and if kids are not meeting these milestones, then they're behind. They're developmentally delayed, and they may need some occupational therapy or some physical therapy to help them along with these things. Okay, so nutrition the first 6 months is going to be breast milk or iron fortified infant formula. Okay, first 6 months, that's what's recommended by the American Academy of Pediatrics. I know that there are parents out there that start feeding babies some soft purees or, rice cereal, things like that before 6 months of age. But it is recommended to only do breast milk or formula for the first 6 months of life. Breastfeeding is the preferred and the recommended food source for kids and for at least the first 6 months. Okay. But obviously every situation is different. If breastfeeding is a struggle or not something that the parent wants to do, then formula is the option for the first 6 months solely. Okay. Then you can add in infant foods. Okay. So it's going to be breastfeeding or formula with baby foods until at least a year. Okay. So for babies, they should be nursing on demand about 8 to 10 minutes each breast. Doesn't always have to be each breast, each feeding. You're aware that they're getting enough when they're just nursing by them growing appropriately on their growth curve. If they're dropping down, then they need to be eating more or nursing longer, or maybe being supplemented with formula. If they're jumping way off their charts, they're probably being fed too often. Okay. And then all babies who are breastfed have to have vitamin D supplementation, 400 IU international units daily. Okay. If babies are formula fed, then that's in the formula. So just the breastfed babies. About 10% or less loss of birth weight is totally normal. Okay. If they're getting to, 15% and continuing to lose, then that baby may need some more supplementation or may need to be admitted to the hospital to make sure that there's not something going on metabolically for those kiddos. Okay. Baby's goal is to be back to birth weight within the first 2 weeks. So at 2 weeks at the latest. They should have 6 to 8 wet diapers a day. That is after about the 5th to 6th day. For the first few days, babies are going to have about 1 wet diaper per day old they are. So on the first day, they should have about 1 wet diaper. Okay. Second day, 2, third day, 3, and so on until about the 5th day where they're having 6 to 8. Okay. Babies should gain about a 1/2 ounce per day in the first 2 months of life. So that's kind of seems like a lot, doesn't it? But that's how rapid their growth is. And remember, babies are doubling birth weight by what age?
6 months.
Good.
6 months.
Yep, perfect. And then they're tripling it by
1 year.
yes.
12 months.
Yes, perfect. Okay, so next, the digestive system. So it's very immature at birth. They're going to have those tarry meconium stools. So the really dark black green that sticks to their poor bottoms. It's really hard to get it off without feeling like you're scrubbing their skin off. Babies need to have those for the first couple of days. And then as mom's milk comes in or as their GI tracts start to mature, then they go to these more yellow seedy stools. Okay. They should be having, a couple of stools a day, but breastfed babies can go longer periods of time between stooling, and that can be normal. Okay. So the reason why they have these more yellow stools is because of their liver starting to mature. Okay. So they're eliminating that bili that way. Okay. The liver is the least mature out of all of the GI organs. So it takes a while for that liver to start functioning how it should, to detoxify things and to process the bilirubin. Okay. Okay, so the second 6 months of life, like I said, the first 6 months are going to be breast milk or formula only, okay? And then the second 6 months you can start adding in baby foods. So the thing that I like to tell parents and nursing students is when you're in that second 6 months, the food that is still the most necessary is still breast milk or formula. So babies are not going to eat enough to maintain their growth pattern with just baby foods or table foods. So they still very much have to have breast milk primarily or formula. Okay. So in looking at the selections and the preparations of solid foods, obviously for younger babies, you're going to want, if they're going to be doing some table foods, soft table foods in longer sticks, okay? Purees are probably mostly what these babies are going to be eating, okay? And it depends on the family to kind of decide what to start with. You don't necessarily have to start with rice cereal or oatmeal or things like that, okay? It is easier just from experience. Vegetables starting first before the sweet fruits, parents, and just from myself knowing, it seems that if you try fruits first, they're not huge fans of veggies after that. No dairy, so no cow's milk until after a year of age, and absolutely no honey until after a year of age. Okay. Meat wise, you can start to do, small pieces of meat. Fish, they used to say not to expose kids to fish or like peanut butter or some of the berries, those higher allergen foods until later. But now they've done a lot of research and they've actually started recommending these kids to get those high allergen foods earlier in the second 6 months of life, because it's less likely that they, if they're exposed early, that they'll develop an allergy to those foods. Okay. So eggs, peanut butter, tree nuts, so like almond butters, things like that. That's all good to introduce fairly early. Okay. So if you have a mom that is nursing still, getting close to the 1-year-old's birthday, that mom may continue to still breastfeed, or they may just transition then to dairy milk, cow's milk. It's recommended around 9 months to start kind of transitioning from, if they're using a bottle, to a sippy cup. So keep that in mind too when you're talking with parents. Okay. But as you're starting to wean from breast milk or formula, you will see around 9 months of age, babies will kind of dip off with their breast milk and formula intake in anticipation for when they start cow's milk. And it's recommended no more than 24 ounces a day of cow's milk. So like I said, food sensitivities. So food allergies are considered a type of sensitivity. Like I said, the most common food allergies aren't always anaphylactic. They can be in the form of eczema, like this kiddo in this picture. A lot of times dairy milk can cause eczema to be worse, along with eggs, things like that. So if they don't have a true anaphylactic allergy to the foods, then there are options to either avoid or go to an allergist and kind of desensitize those kiddos to those allergens, okay? Even if kids are anaphylactic at times, some allergists will start to, as they get older, work on those food allergies with desensitization too. So they would give them like a teeny tiny amount of their allergen and make sure that the patient has an EpiPen, in case they would have a reaction, and keep an eye on them in their office and see if they have a reaction. If they don't, then next time they'd bring them in, they'd give them a little bit more. And then over the period of time, they may then become desensitized to that allergy. That's kind of a newer thing that they're doing with patients. If it's an intolerance, so something like, it gives me diarrhea, then that's not necessarily an allergy. You might have patients call it an allergy, but it's not, it's more of an intolerance, okay? Atopy, like I said, that looks at the eczema. So it's called the kind of allergic triad. So kids, you'll see a lot of times with kind of some allergic rhinitis or kind of runny nose, seasonal allergy stuff. And then they might get rashy with eczema or atopic dermatitis. That's the same term as eczema, okay? And then a lot of times as they get older, then if they get sick with something, they have kind of reactive airway disease and wheezing, and they wind up with an asthma diagnosis. So a lot of times if kids have allergies, eczema, then they're going to wind up with asthma. Or if they have allergies and asthma, then they're probably going to have eczema. So those three kind of all go hand in hand. Okay. So with anaphylaxis, like I said, those kids are going to have EpiPens. So if kids have anaphylactic reactions to certain foods or other things in their environment, then they need an EpiPen. If the EpiPen is used, they need to go straight to the ER. Okay. Symptoms of anaphylaxis. Can anybody tell me some symptoms of anaphylaxis?
Swelling of the lips.
Yeah,
Return-
yeah. What else?
Itching.
Yeah.
Sorry, I didn't hear you.
Pureness.
So itching.
Itching. Itching of where specifically?
Maybe the mouth or the skin or just the
Mouth or tongue? Uh-huh.
Mhm.
Yeah. What else?
Swelling in the throat.
Yeah. Are they going to be able to breathe very well? Usually?
No.
No, they're going to struggle to breathe, right? What is their heart rate going to do you think, if they're anaphylactic?
Tachycardic.
Yes. Good. Awesome. So those are kind of some signs to watch for if kids have allergies to foods or allergies to the environment, to keep an eye on them. And if they're having those symptoms, then they probably need to be given epi. It's better to give epi and then have them go to the emergency room than to not give epi and them have death and their throat swollen shut enough that no one can intubate them by the time they get to the ER. Okay. So kind of err on the side of caution with that. Testing wise for food sensitivities is a little bit more difficult because some of the blood tests and some of the skin tests can give you kind of false positives. So that's where kind of the trials in the office and things, and then continuing monitoring that blood work annually or every few months is necessary. For typical like environmental allergies, they will do typically a prick test, so like a skin test on the back, inject a little tiny portion of that allergy, and then watch and see if it enlarges into a hive. And that's kind of how they do that testing for allergies. And then obviously it's either avoiding if we are totally anaphylactic and cannot desensitize, or looking into desensitization. Oh, sorry, I forgot to ask, what do you guys want to do for breaks? Do we want to take 2 separate 10-minute breaks, or do we want to get out of class a little bit earlier?
I'd rather get out early.
Okay. Is everyone okay with that?
Yeah.
Okay, perfect. That's what we will plan on doing then. So I will have you guys stay then until 4:55. That will be full, and that's Eastern time. That will be full attendance, okay? But like I said, if you need to run to the bathroom or anything, go ahead and do that. Okay, so sleep and activity for infants. Sleep patterns totally vary. Not all infants are going to sleep through the night. Some infants go all the way up until they're 1 and they're waking up every 3 hours. So it just kind of depends. Usually by 3 to 4 months, though, typically kids can sleep about 9 to 11 hours at night stretches. Okay. Breastfed babies are going to be waking up the most, where formula fed babies tend to stay a little bit more full through the night. But sometimes formula fed babies awaken more often than breastfed baby. It just kind of depends on the kiddo. Babies need to sleep on their backs all alone in their own bed. Okay. And it is recommended that babies sleep at least for the first 6 months of life in the same room as their parents. That's to reduce SIDS risk as well. Okay. Babies also will frequently nap. They might do several short 45-minute to an hour nap throughout the day. They might do one longer stretch. So they might sleep 2.5, 3 hours in the morning and then a couple hours in the afternoon. They might just do one long nap and then several short naps. But for the most part, babies are sleeping for the first 6 months about 15 to 16 hours a day, which sounds like a ton. Okay. Younger infants are sleeping even up to 22 hours a day. So like the first couple weeks old. Okay. Walkers, swings, and playpens are not necessary. So walkers and swings and playpens, there have been a lot of, not a lot, but several deaths from these objects, typically in relation to not being buckled appropriately or something like that, or the baby walkers, somehow the babies go down the stairs and get injured. So all of these things are no longer really recommended. The other thing about swings, as babies start to be more mobile, then they're also able to fall out of those easier as well. Crib wise, so they need to be in a bassinet or a crib or a pack and play until they're able to, or, like a smaller crib, until they're able to kind of move around. And then as soon as they start rolling or being more wiggly, then it's recommended to go to a crib that's on its very lowest setting. Okay. Or pack and play on its very lowest setting. Once babies start crawling out closer to toddlerhood age, then it's recommended to put them in a toddler bed so they're not falling out of their crib. Dental health. So fluoride use starts at 6 months. That's when it's recommended. Prior to that, as teeth are coming through, you can utilize just a toothbrush to kind of get them used to having those teeth brushed. You can just do toothbrush and a little bit of, kind of wet the toothbrush. Soft bristle toothbrush. They make the teething kind of toothbrushes. Those are good too. And, prior to tooth eruption, you can also encourage parents to just kind of use a nice wash rag to kind of run over the gums to get them used to having fingers and things in their mouth. Okay. Is it Avani?
It's Ebony. I was
Ebony?
gonna ask about what you just said. It was saying to use the clean rag and use it, damp it over the gingiva because the brush can cause damage.
It can't, it doesn't always cause damage. It's just good to get them used to, fingers and things in their mouth. Okay. But soft bristle toothbrushes when we're using toothbrushes, when they have teeth. Okay. But until then, better to just use kind of a wet rag, clean rag, obviously. To try to prevent dental caries or cavities, no bottle propping. Okay. I can't express this enough. Don't prop the bottle up. Don't send them to bed with a bottle. Don't feed them a bottle and put them right to bed without brushing their teeth, because that's setting up the perfect storm for cavities. No fruit juices at all, period. If people are going to do fruit juices, then make sure that they're brushing their teeth, when they're done with their fruit juice and they're not going straight to bed. Pacifier use is good for SIDS risk. It lessens SIDS risk. But obviously the longer they have that pacifier, it can kind of cause the teeth to protrude and affect their need for braces down the road. Okay, so ideally pacifiers should go away by age 2. Okay, so how to figure out how many teeth kids should have through age 2. So you're going to look at the kiddo's month and age, and that should be the number of teeth. But you're going to subtract that. So, okay, so 8 months of age, and then you're going to take that minus 6. And then that will be the number of teeth. So if they're 8 months of age, then you're going to subtract 6. They should have 2 teeth about at 8 months. Does that make sense? So however old they are in month, you're going to subtract 6. And then that'll tell you about how many teeth they should have. Teeth eruption starts around 6 months of age, 6 to 7. Okay. Doesn't mean that some babies may have teeth earlier. Some babies do. And some babies don't get their first teeth until closer to 9 months. Like I said, everything's kind of on a range here. Vaccinations, immunizations. This is a hot topic. If anybody's been looking in the news recently. So numerous childhood vaccines. There's a schedule that the CDC recommends every year for parents to follow. Some schools, it's mandated that kids have to have certain childhood vaccines to be able to go to school or go to daycare, and that varies by states. On this list, a lot of them are in combination vaccines. So typically hepatitis B, diphtheria, tetanus, pertussis, polio, Haemophilus influenza B or Hib. Those are typically all in one vaccination. Your pneumococcal vaccine is going to be separate. And then rotavirus is a drink vaccine, not an injection. And they're going to get that big combo shot, like I said, the hepatitis B, diphtheria, tetanus, pertussis, polio, and Haemophilus influenza, plus the pneumococcal, plus the rotavirus at 2 months, 4 months, and 6 months. That's what's recommended. Okay. Then they get boosters of the other vaccines as they get older. So like the MMR vaccine or measles, mumps, rubella, and the chickenpox vaccines, that's not until typically 12 months of age that they get those. Hepatitis A vaccine, that's usually around 12 months that they start that. Meningococcal vaccines, they don't do those until they're teenagers. Same with the HPV. So around age 11. Okay. So they're going to get a lot of vaccines in those first 2 years of age. A lot of doses. Influenza vaccines, you can start those at 6 months of age. Same with COVID vaccines if parents are still interested in that. Okay. But like I said, with this being in the news, there's a lot of things that may be changing or may not be changing. We're not quite sure yet. But I'm sure you all have seen numerous measles outbreaks happening because of our vaccine immunity, herd immunity level threshold kind of dropping. Okay. So special health problems in this age category, colic. So this is abdominal pain. Perioxysmal abdominal pain is another term for colic. You've heard babies called colicky babies. This happens typically peaks around 4 to 6 months or 4 to 6 weeks of age, but can last up until 4 to 6 months for some babies. Okay. They're going to cry and be inconsolable for at least a couple of hours a day, a couple days a week for a couple of weeks. That's kind of how you get your official colic diagnoses. I know a lot of people will say, oh yeah, they're colicky and they just fuss, here and there, but that's not technically colicky. Therapeutic management and care management. Some parents will try probiotics or gripe water or gas drops. Those things don't necessarily help, but some parents feel like they do. The best thing to do is shushing, swaddle, rocking, kind of try and laying them on their belly on your arm while you kind of bounce them. The 5 S's is what it's called. That's really helpful if you have a colicky baby. Okay. Colic, you also need to tell these parents, if they're getting overwhelmed with emotion and feeling frustrated, they can put the babies down in their bed or in their crib and shut the door as long as there's no, risk factors in there for them, like a dog or something that can knock them over, or another sibling that could, injure them. But always good to take breaks, have your other support person, whether that's your spouse or your partner, kind of take over for you if you're starting to feel overwhelmed. Okay, colicky babies are hard to care for. Okay, sleep problems. So perisomias and dysomias. So there's dysregulation in their sleep pattern. Okay, not uncommon in this age group. They might have their days and nights flipped as well. The best thing to do is try to keep to schedules and routine. Okay. Failure to thrive. So like I said, we talked about this a little bit earlier. If kids are falling off of their growth curve, that is a growth failure. That is considered failure to thrive. There is some lab work that you should look into to make sure that it's not something metabolic going on, or to make sure that they don't have like a dairy intolerance or something that's causing them to not want to finish those formula bottles or the breast milk. A lot of times these babies, if they continue not gaining back up to birth weight or to continue dropping off of their curve, they're going to be admitted for a period of time and kind of observed to see if there's some knowledge deficit or something that's contributing to failure to thrive, or if it's purely kind of like a DHS situation where there's not bonding that happened and, we're not feeding baby appropriately. Okay. If there is early intervention, then prognosis is pretty good for kids with failure to thrive. But if it's kind of just allowed to go on for a longer period of time, then prognosis can be pretty grim. Okay. Failure to thrive a lot of times is cared for in the hospital with multiple agencies or multiple different interprofessionals. So you're going to a lot of times have a dietitian from the dietary department involved, the provider, nursing. A lot of times these kids with failure to thrive also have developmental delays. So occupational therapy or physical therapy for those gross or fine motor delays that these kids may be having due to lack of nutrition. Okay. Positional plagiocephaly. So that is where kids need to utilize a helmet because they've laid and created flat spots, abnormal flat spots on the back of their head. Okay. Depending on what age they get the helmet, depends on how long they have to wear the helmet and how much improvement you can get from the helmet. Diaper dermatitis, you see that in this picture. So obviously diaper creams, applying a barrier cream with each diaper change. Sometimes yeast can be involved. This picture very much looks like yeast because it's kind of the kissing lesion pattern. So both sides look very similar. And then they have the satellite lesions are what these little dots are called. Okay. So you need a yeast cream like nystatin for this diaper rash. Seborrheic dermatitis or cradle cap. You can see that in this picture. Those are kind of those buildups in those kind of sweat gland areas. Okay. So for cradle cap, it's not necessarily something that's overly problematic. They make different creams and things that you can put on now for cradle cap. But the best thing to use is mineral oil or baby oil. Okay. And you just have parents put that on, let it sit for a little bit right before they're going in the bath, and then scrub with a soft bristle little brush, and then rinse their hair with soap or shampoo and water, because otherwise they'll have really greasy hair. The other thing about cradle cap, a lot of times that's kind of a sign of a potential dairy intolerance. So if parents will cut dairy, like switch from a dairy-based formula to soy formula or to Nutramigen, or something that's more broken down even that doesn't have dairy or soy, then you'll a lot of times see an improvement in the cradle cap Same with if moms eliminate dairy or soy or both from their diets while they're breastfeeding. You can see improvement in cradle cap. SIDS. So risk factors, there are a variety of risk factors for SIDS. Actually being the male gender, you're at an increased risk. Non-white ethnicities are at an increased risk. Nighttime deaths, that's the most common time that SIDS is occurring because you guys or parents are sleeping longer stretches or trying to at least. The peak time frame for SIDS deaths are from 2 to 4 months of age. Okay. Parents who are smoking in the home, that's an increased risk. Parents or babies who aren't be putting laid on their back to go to bed, that's an increased risk. Babies who have too many layers on and they get hot at night, mild respiratory illnesses, not breastfeeding, air pollutants, all kinds of things. Mattress that's a really soft mattress, the little bumpers that you can get, or the mesh that you can put there too, blankets, things like that are all increased risk factors for SIDS. Okay. Protective factors, like I said, breastfeeding, pacifiers, those sort of sleeping in parents' rooms until 6 months of age. Those are all more protective factors. Okay. ALTI, or apparent life-threatening event. This can kind of look like a potential SIDS case that maybe parents wound up waking up and kind of catching it and intervening. So ALTIs, these kids have to be admitted. A lot of times they have EEGs on their head to see if it was some sort of a seizure that they had. They also frequently have apnea monitors, so you can kind of see that here. It is something that we attach to the chest in the hospital, and it will alert really loud if babies go for longer than a period of time between breaths. Okay. You also want to, like I said, look for seizure disorders or anything else that could have caused that. So heart issues, pulmonary issues that could cause an ALTI. Okay. And then obviously if there's some reason that they had this ALTI, then you have to manage that. So if they have a seizure disorder, then, you know, they may need a medication for seizures, or a cardiac problem. They may need surgery to fix their cardiac defect. Okay. Health promotion in infancy. Safety is obviously for each category of child, there's a different kind of thing to focus on for safety and injury prevention. In infants, it's car seat safety, motor vehicle safety. So they need to be rear facing. Okay. The best thing to do is rear facing until the max height and weight on your car seat. That is the very safest thing, even if we're crisscrossing our legs in the back seat or look totally cramped. If we're still under the height and the weight of that car seat, they need to be rear facing. Okay. Same with forward facing. Okay. So your role obviously is ensuring that as parents are going home with babies, that they are taught these safety things. So infant CPR, obviously water safety, drownings can be a huge thing too during infancy, even just in a bathtub or toilets, things like that. As infants start to get on the move, you know, they're curious about things, so they need to be supervised. Okay, here's a question. So Letitia is a breastfed infant, being seen in the clinic for her 6-month checkup. Her mother tells the nurse that Letitia has began sucking her thumb. Which is the best nursing intervention? Just go ahead and unmute.
C.
Okay. What's everyone thinking?
I think C as well.
Okay. Yep. Totally normal. Sorry, I'm going to go back. Oops. Yes, C is totally normal. You can try to recommend that, a pacifier may be easier to implement than her thumb, because we might still be thumb sucking, clear till, 4, 5, 6, which can affect the teeth development as well. And a pacifier is easier habit to break than her thumb, but at 6 months of age, that's pretty typical. Okay. Okay, any questions before we go on to theorist? No? Okay, so psychosocial development. This is your Erickson, okay? Psychosocial is Erickson, always. So infants, they can cry, right? That's kind of how they express their needs, so by crying. So if they're crying and they're getting fed, or they're being held, or they're having their diaper changed, then they're developing a sense of trust. If they're crying and crying and crying, and they're not having interaction or stimulation, they're not being fed, they're not having their basic needs met, then they're going to develop mistrust. Okay? So if mistrust occurs, then you're going to see kids be more narcissistic, so more self-centered. They're going to, have more behaviors like biting, hitting, kicking, because they've kind of formed this mistrust and they haven't been secure enough to feel that they have a sense of trust in people. So this is infants, psychosocial Erickson. Trust versus mistrust. Cognitive, our cognitive theorist is Piaget. So birth to 1 month is use of reflexes. So this is the sensory motor phase, okay? So birth to 8 months is sensory motor, okay? But it's kind of in two little categories. So birth to 1 month is use of reflexes. So like your startle reflex, your Moro reflex, things like that. From 1 to 4 months of age is the primary circular reactions. So child sucks their thumb on accident. They kind of find their thumb, put it in their mouth. They decide that, I kind of like that. And then they figure out that they can do it again. That's primary circular reactions. Okay. From 4 to 8 months, that's secondary circular reactions. So this is going to be imitation, play, coordination with another outside source. Okay. A schema is a cognitive framework. So this kind of shows you, they pick up a rattle, they were grasping, gazing, reaching for that rattle, and that's a schema. Okay. Piaget. So Piaget is 4 stages, cognitive stages, okay? Sensory motor is birth through about 24 months. Pre-operational is toddlerhood, so 18 to 24 months to early childhood, 7. So school age kids. Concrete operational is 7 to 11 years. And formal operations or formal operational is adolescent through adulthood. And when we cover school age kids and adolescents, we'll go through concrete and formal operations, okay? The development of their body image relates to their sensory motor development for infants, okay? So kinesthetic, so moving their bodies, and tactile experiences, so interacting with objects that they can touch and grab. Those are the first things that infants become aware of with their body. Okay, so being able to kind of move their arms and then interact, like touch things. The mouth is the key area for pleasure. Okay. And infants, think about it. They're getting their food through their mouth. Okay. That's how they get pleasure. Okay. And then object permanence becomes a thing that kids do around 9 months of age. So until 9 months of age, typically, if you have a parent cover up a ball with a blanket in front of an infant, they will think that that object totally disappeared. Okay? They'll think it just poofed, went away as soon as the blanket hit it. Around 9 months of age, they become aware of object permanence. So the parent, once again, puts the ball in front of them, covers it up with a blanket, and that child pulls the blanket up because they know that that object is still there. Okay. This has to occur for kids to continue to develop their body image. Okay. By the end of the first year, they're able to recognize that they themselves are separate from parents. Until about 6 to 8 months of age, infants usually see themselves as still a part of their parent, especially their mother. Okay. Social development, so attachment, that starts basically right after delivery with skin to skin. So making sure that these babies get attached is extremely important. Totally normal for kids to have some separation anxiety between 4 to 18 months. And then around 6 to 9 months, you start to see that stranger danger. So kids are going to not want to go to other people that they don't know. They're going to be able to see and kind of tell the differences between faces and realize that that person is not their parent or someone that they know. And it peaks typically around 9 months. They're going to continue to develop their language through interacting with other kids, interacting with parents, and play, and continuing to get more organized with their fine and gross motor skills as they get older. Okay, toddler and family. So toddlers, they're kind of the most difficult sometimes, have the most behaviors, test people's limits and patience, kind of wild children. You've all probably heard of terrible twos. So toddlerhood goes from age 1, so 12 months to 36 months to age 3. Okay. This is very much they're exploring with their environment. They're pushing boundaries. They're seeing what they can get away with. You're going to see temper tantrums. Okay. They're going to be obstinate. They're going to try to defy and see what they can get away with. And they're going to be kind of a little bit more negative. Their favorite word is typically no, right? You've heard those toddlers tell you no, and mine, right? They're self-centered as well. Okay, so proportional changes of toddlers. So your weight gain is going to slow. Okay, so they're going to go from tripling their birth weight at a year of age to growing about 4 to 6 pounds a year during toddlerhood. Okay, by 2.5, they'll quadruple their birth weight. So see how much longer that's taking to go quadruple their birth weight when they tripled it their first year of life. Height is going to be about 3 inches a year. They're going to have longer legs than their trunk as they go through toddlerhood. Prior to that, in infancy, our trunk is typically longer than our legs. Okay. And growth is more stepwise versus a straight up curve. So it's more of a gradual curve. Okay. Head circumference is typically equal to chest circumference. So still those larger heads, but they're starting to kind of equal out. And then at age 2, kids are about half of their adult height, which is crazy to think about. So looking at the systems maturing, so continued maturation of all systems, but most physiologic systems are pretty mature. So our respiratory system's pretty mature, Our body temperature is regulating. Our heart rate is pretty steady, like it's kind of more normalized to typical range, closer to the adult range. Okay, it's still going to be higher, respiratory range. And there's a vital sign handout in your week 1 announcement too for you guys to peek at. They start being able to control their bowels and their bladder. Babies or toddlers can do that around 18 months of age physiologically. Now, there are some kids that are sooner, and then some kids that are delayed in toilet training. Okay. Their biggest defense mechanism is skin. Okay. Against infections. Toddlers, a lot of them are in preschool or daycare, so they're going to be exposed to a lot of different illnesses, and most commonly upper respiratory illnesses, but also things like strep throat. So tonsillitis is typically the most common form of strep throat that we think of, and otitis media or ear infections. Okay, so kids are going to be getting multiple illnesses a year during this toddler time period, just like they did in infancy. And that's just because they're developing their immune system. Gross and fine motor development. So there is refinement of coordination that's happening between ages 2 and 3. So all of their movements are becoming more refined. So they're going to start to be able to throw balls by about 18 months. Walking is a lot more coordinated. They're going to start running. And then their manual dexterity, they're going to start coloring, and it'll be these big, huge scribbles. And then, they might be able to be a little bit more neat with their coloring as their dexterity improves around 12 to 15 months. Sensory changes. So in toddlerhood, so by age 3, we should be about 20/40 for our visual acuity. Depth perception is still developing. So our risk factor, because our motor development is still happening too, is falls. Typically falls from heights, because we're curious toddlers. We climb up, maybe up the stairs or up a ladder, or climb up on playground equipment and try jumping off or we fall off because we're not super coordinated yet. Hearing, smell, taste, touch are all developing. Toddlers become picky eaters. They may have loved a food and then they decide all of a sudden that they hate that food. So totally normal for kids to do that. They might eat only, a sandwich with ketchup on it for 5 weeks, and then all of a sudden they decide that that's not their food that they like anymore. They become unwilling to try new foods because they stink or because they look gross. And sometimes that's influenced by their daycare or by preschool environment to other kids saying that things look gross that they used to like. Okay. Their senses are kind of driving how they're exploring their environment and interacting with their environment. Psychosocial development is Erickson. Okay. So we're learning a sense of autonomy. Okay. This stage is autonomy versus shame and doubt. So if kids don't have some autonomy, so they're not able to do some things on their own without parents' assistance. So, me do it, I do it, they want to be doing the things, even if it takes you a lot longer throughout your day. If toddlers, aren't allowed to do that, then they're going to be a lot more negative and hard on themselves, and they're going to doubt themselves. Okay. Now, toddlers are normally negative, so they like to say no to things, but you'll see that negativism worsen if they're unable to do some things themselves. Okay. Their id and their super ego, they have very big self-centered, narcissistic tendencies in toddlerhood. Okay. Having routines or rituals that they do allows toddlers to feel more comfortable and more safe. So they like to kind of know what to expect and not have much variation from that. Cognitive development. So this is Piaget, okay? So the 6 stages of sensory motor. So simple reflexes, which we talked about in infancy, right? That's our Moro reflex, the rooting reflex, the grasp. All of those are simple reflexes. Then that primary circular reactions. So we accidentally get our thumb in our mouth once. We decide we like that. And then we wind up figuring out how to get it in our mouth for comfort. And that's how we seek pleasure. Okay. And we're doing that purposefully after we've done it accidentally. Secondary circular reactions, that was having another stimulus or schema. There's a ball in front of them and you're trying to grasp or roll that ball. Okay. Coordination of reaction, tertiary circular reactions, those start closer to 13 to 18 months. So they're able to differentiate from themselves and other objects. So they're able to realize that they are separate from their parents. They're learning about kind of spatial relationships. So, and then that object permanence as well. In this tertiary circular reaction, those are some examples. So the object permanence piece. And then later on in toddlerhood, so 19 months to 24 months, they're starting to imitate behaviors. Okay. They're starting to understand domestic roles in the home. So, moms being girls, maybe potentially carrying babies around more often because they've watched mom be maternal, or dad, going to work kind of thing. So they're starting to mimic some of the domestic their home environment. Okay. And then the concept of time is essentially not existent. Okay. 12 to 24 months. This is a continuation of the final 2 stages of sensory motor phase. Okay. Psychosocial development, we kind of already talked about this. Here's the Piaget, learning spatial relationships in Piaget, applying knowledge that they've learned in other situations to a new situation. And then they're actively experimenting with their environment. Those are the tertiary circular reactions. Okay. This is kind of the same way. So autonomy versus shame and doubt. So to be autonomous, toddlers will need to have a sense of security, start to learn patience, and to be encouraged. So if parents are really restrictive, they don't allow them to do some of the tasks that they're capable of, then they're going to have more shame and doubt versus a parent who's allowing them to do some things that they're capable of. Okay. And if they're developing shame and doubt, then it's going to be really hard to get them to do other things. So this is what we were talking about, that primary circular reactions between 1 and 4 months. They're starting to repeat actions because they're pleasurable to them. Okay. And then we're intentionally repeating actions to get a response. So we grab that rattle and we shake it and we see if our parents turn and look at us. Okay. And then the tertiary circular reactions, that's where we turn things into a game. So we have our bottle or our sippy cup from 12 to 18 months, and we throw it on the ground and see if our parents pick it up or if someone picks it up. As soon as they pick it up, then we're like, okay, that's going to be fun. I'm going to do that again. And it turns into a game. Okay. So kind of that trial and error experiments. And this, once again, is cognitive development, sensory motor, and preoperational phases, which is Piaget. Okay, development of gender identity. That typically starts to happen by age 2. Okay, it's totally formed by age 2. So kids will start to play house and typically follow their gender roles. Okay. Exploration of the genitalia is common and normal, age appropriate at this age. Okay. Parents should be accepting of this and try to encourage that kids do this in, their room or somewhere not out in public. But the more attention negative attention that you give kids interacting with their genitalia, then sometimes it makes it more difficult to break them of that kind of habit. Okay. Okay, social development. So they understand that they are separate from their mother or their parents. So the separation anxiety you can kind of see come back around 18 months again after that 9-month peak. Okay. They're starting to do things more individually for themselves. Okay. And starting to transition with objects. So they might feel like they want to start going to bed on their own as long as they have, a teddy bear to kind of soothe them and their parents tell them good night instead of parents having to have them sleep in their same room or sleep in bed with them. So they're starting to become more individualized. Language. There is a huge development of language over the toddler time period. So at age 1, they should be using one-word sentences. By 2, they should be using multiple word sentences, at least 2-word sentences by 2. Okay. If we are not talking by 18 months, then we get concerned that that kiddo may have autism. Okay. So just kind of another thing to be watching for as nurses. If kids are behind, then they were on track and then all of a sudden they start falling behind, that can be another, or regressing, that can be kind of another sign of potential autism. And the earlier you intervene with kids with autism, the better. Personal social development of behavior. So toddlers are getting more independent. They're maybe looking at feeding, dressing, playing with themselves, undressing. They are strong-willed and they want to do them. There are things that they can do themselves. And if they're not allowed, then that's where a lot of times you'll see those behaviors or those tantrums happen. Okay. Toddlers, as they go through toddlerhood, they start to become aware of others' feelings and be concerned about others' feelings. Okay. And if they're not becoming aware of others' feelings, so if mom's crying and that toddler doesn't say, why are you crying, or go over there and act concerned, then you get concerned about a kiddo potentially having autism as well. Okay. They start to understand what words you're saying to as parents or as caregivers for them. Play. Toddlers are learning through play. Okay. This is the way that they learn, by observing and playing. Okay. Interacting with others is really important to toddlers. As they progress through toddlerhood, the older they get, the more they're going to interact with their peers. Okay. Typically, toddlerhood is going to be parallel play, which is 2 kids playing next to each other, maybe even playing the same thing, but they're not interacting with each other at all. They're just playing next to each other, but there's no conversations between them about what they're playing. Okay. Imitation is very common. So like I said, they're starting to kind of notice those home environments kind of rules. So girls might start to, care for their babies, or boys might start to, do the work that their parent does, or vice versa. Okay. So they're starting to imitate people that they know, or they're watching another kiddo play and they start imitating what that child's playing. Tactile play is going to be kind of that sensory play. Okay. Toilet training. So they have to have the 3 signs of readiness, which is dry for 2 hours. Okay. They're interested in the potty and usually they should be dry or have more dry diapers overnight. Okay. This typically happens between 19 and 24 months, like I said. So physiologically, they can start at 18 months being able to potty train. But if kids don't have signs of readiness, then I wouldn't push it. Sometimes sibling rivalry can be a factor in growth and development. So they may want to, keep up with their siblings. So they're going to walk earlier, they're going to talk earlier, they're going to potty train sooner. Or sometimes it's the opposite. They're going to not want to do those things because their siblings are doing those things. Temper tantrums can happen whenever, but usually it seems that they happen around bedtime because those toddlers do not want to go to sleep. And they're trying to do whatever they can do to not go to sleep. Negativism is that no or me do. So they're really trying to be autonomous. Okay. So that's what negativism is. And regression is they maybe have been totally potty trained and then a new baby comes along and they lose that skill. So they start having accidents. Okay. So going back to old habits or level of function that they previously functioned at during times of stress. Or like I said, that could also be if it doesn't come back, so they don't regain that loss of function during a regression, and let's say their environment becomes less stressful and they don't regain that, then that might be a sign of autism. Okay. Nutrition, still very important at this age, but you start to see some more troubles with nutrition because they become very picky, and they may not want to eat meats. They might be more vegetarian diets. So, we might need to figure out some ways to supplement some protein. And then they may only want to drink whole milk and not really eat a whole lot. So then we have to, or they may not want to drink whole milk at all. And then we have to look at supplementation, like vitamin D and calcium if they're not drinking whole milk. Okay. Because they've gotten so picky, you can see some kids go into physiological anorexia. Okay. So their body is just kind of maintaining with the nutrition that it's given. You can see kids also start to have sleep problems in toddlerhood, like night terrors and things like that. Dental health, regular dental visits. So every 6 months, they should be brushing their teeth in the morning and at night. Flossing should start, for sure after 6 years of age when they have the coordination to be able to floss themselves. But if you have 2 teeth together, as parents, you can help them kind of floss those areas as well. Fluoride, that starts at 6 months through fluoride toothpaste, or if they go to dental visits, then they might also get fluoride painted on their teeth to help reduce dental caries or cavities. Early childhood caries, like we talked about, bottle propping, milk before bed, juice, those are all factors related to having an increased risk for caries. Probably the biggest safety concern in toddlerhood is accidental poisonings. We're curious, we're climbing up, we are, seeing medications that are there, getting into the meds because they weren't put up out of our way and accidentally overdosing on those meds. As far as heavy metal poisoning, mercury poisoning, I don't see this as often because a lot of our mercury that used to be in thermostats and things have gone away. But obviously if kids are eating a lot of like swordfish or tuna, things like that, they can still get mercury poisoning. Or if they have a mercury thermostat in their home, that could still be a possibility. The more common heavy metal poisoning is lead. Okay, so lead paint, homes that had lead-based paint, homes that have plaster, that starts to kind of crumble off and kids are putting that in their mouth in toddlerhood, or they're eating a bunch of dirt outside, or their parents work like at somewhere where they're building batteries or using certain chemicals, then those can all cause an increased risk for lead poisoning. Or certain candies. So some candies from Mexico actually can increase the lead level. They have low levels of lead. Okay. Pathophysiology and clinical manifestations. So kids with lead poisoning are going to start to have developmental delays, can eventually progress to like mental effects that are unreversible. So by we screen routinely for lead poisoning, typically between 9 months and a year, and then often again between 18 months and 2 years of age, so 24 months of age, typically by a finger poke or a venous blood draw. And if that comes back elevated, then we can look at, do they have lead paint? What sort of things can we do to try to reduce their risk for that lead poisoning? The other thing too, if kids are iron deficient, which is very common in toddlerhood because we're not eating, a lot of green leafy vegetables or red meats, then it's very common for kids to be iron deficient. And we're also eating or drinking a lot of whole milk, which binds and competes with iron in the gut. Then that can also increase the risk for lead poisoning if we're iron deficient. So if kids are iron deficient and they have a high lead level, then they also need to address their iron deficiency. So that way their lead level can improve. If the lead level is too high, then they have to have chelation therapy, which is what this machine is throwing. So showing, filtering out that lead. Chelation therapy is quite a comprehensive and undergoing. It's, takes a lot out of kids and having to do that in families. But it is really effective. Okay. So your care management is obviously going to be managing if you are having a kiddo that has chelation or has to do chelation, managing, those lines and making sure that kids aren't, getting those lines pulled out while they're getting chelation. Okay. And monitoring, for signs of worsening lead poisoning. Like I said, ingestions are probably the most common poison. So cosmetic products, medications, cleaners, foreign bodies. I mean, kids are exploring the world through their mouth in toddler stages. So those are probably the most, some of the most common things that happen accident-wise. So making sure that parents have poison controls number is probably the biggest thing to make sure. If a parent calls in saying that a kiddo, got into some of their medicine or another product, they also need to go to the emergency room. Okay. You may wind up doing some like putting a tube down and charcoaling a kiddo potentially to get that back up. You kind of go based off of what poison control tells you when you give them a call. Okay. And obviously preventing them to continually do this again. So what you can do is encourage parents to, put those products up or lock them if kids are really persistent in trying to get into them. Motor vehicle, so car seats are still very much a thing. Motor vehicle related injuries are still the most common injury in toddlerhood. Drowning, though, because we're getting in burns and falls because we are, getting more mobile and being able to get into the pool or get into the bathtub and things and get the water running more easily than we were in infancy. aspiration, suffocation, we're, putting the bags over our head because we think it's funny, or climbing up on things and falling, or pulling a hot pan off the stove just because we're curious what's in the pan and we pull our hot water on ourselves. So all those sort of safety things will be very much important for you as potential pediatric nurses to be giving parents anticipatory guidance. So giving them guidance on what they can kind of anticipate in the future as risk for their toddler. So car seats, you can kind of see here how they have looked over time, and now, car seats don't even necessarily look like this because they now have a 5-point. So this is a 3-point harness, and now they have the 5-point. So it's even an extra clip. So car seats are typically, there's different expiration dates, usually 6 to 10 years from the date it was manufactured. The manufacture date has to be on the car seat. If for some reason it's scraped there in the plastic where it's at, a lot of times you can look up at the NHTSA, so National Highway Traffic and Safety Administration website. You should be able to put in the type of car seat that you have and get that manual and get that information. Also with NHTSA, you can sign up for recalls in case car seat is recalled, and they'll send you an email. So babies and toddlers should be in the back seat, rear facing until 2 years of age. Ideally, that's the best thing to do. At minimum, that's the law. But in some states, the law is less than 2 years of age, or it's maybe weight-based. But what the American Academy of Pediatrics recommends is weight, or maxing out the height and weight of that individual car seat. And the car seats weights and heights are all slightly different. So you have to look at that too. It's usually on the side of the car seat or in the car seat manual. The safest spot for kids to ride is in the center of the back seat. Okay. As they get older, making sure that that shoulder strap is coming across, as they get into school age and it's tight. Their car seat straps and harness, there's differences. Some of them have to be up higher, some of them have to be down lower. So you just have to look on that actual car seat. And then a good way to know that their harness is tight enough on their chest, whether they're rear facing or forward facing, is if you can drag your fingers over the harness and pinch any fabric, then it's too loose. So that needs to be tightened again. Parents, if they're questioning their car seat being installed properly or that their kiddo is in there good, they can stop at fire stations or police stations. A lot of them have certified car seat techs that can make sure that that kiddo's safe and in the right seat. Okay. Refinement of coordination occurs by what age?
$12 to 15 months.
Okay. What age do we throw a ball?
18 months.
Yep. What about motor development or fine motor development? So improved manual dexterity.
2 to 3.
So the improved manual dexterity is actually closer to 12 to 15 months. And then the refinement of coordination is between 2 to 3 years. So it's just kind of continuing to mature. All of those coordination skills are maturing further between 2 to 3 years. Okay. All right, preschooler. So preschool is going to be 3 to 5 years of age. Okay. So preparation for school, right? They're going to start going to preschool, or they're going to be getting ready to get into kindergarten, closer to 5 to 6 years of age. The biggest thing for parents to do is read to their child each day, because that sets kids up for having a positive attitude towards learning at school. Okay. Interacting with other children is going to be a huge portion of what they're doing at preschool, learning their environment, kind of how they fit with other kids as well. They're having increased attention spans and memories during preschool. 5-year-olds, you can probably keep their attention for 5, maybe 10 minutes. But that continues to progress from age 3 to 5. Okay. They're starting to learn how to interact and cooperate with the teacher and also other children. Okay. They're starting to maybe for the first time experience separation from their parents if they haven't been in daycare. So sometimes that can be really tough. Okay. And they're starting to use language and learning symbolization. So physical growth is going to slow and it's going to be more stable. So kids are going to gain about 5 pounds a year, and then about 2.5 to 3 inches a year. So a little slower than toddlerhood. Okay. Body systems are pretty much mature and stable. Okay. But, and they can also adjust to changes in their environment or stress on their body. Whereas in toddlerhood, it was really difficult for them to adjust to changes in their environment and stress as far as their body systems go. Okay. Gross motor in preschool age, we're walking, we're running, we're climbing, we're jumping. Those are all very well established. And we're just starting to do more big movements. Okay. Hand-eye coordination is improving and pretty refined during preschool age. And we're starting to be able to dress ourselves and draw and color. Okay. Psychosocial development. So this Erikson stage is sense of initiative. So this is initiative versus guilt is preschool age. So 3 to 5 is initiative versus guilt. Okay. So if we are able to take initiative, do things ourselves, like learning right from wrong, learning consequences. If we make this choice, then this is kind of what happens. Then we feel a sense of initiative. So we can kind of progress then to the next Erikson stage. If we are not allowed to develop a sense of self and a self-conscious and knowing right from wrong, then we may feel guilty, anxious, or fearful. Okay. Especially if we do something and we get a different response than what we think we should at preschool. Okay. Cognitive development. So this is Piaget. We're getting ready for school. We're getting ready for sitting and learning in an environment. Okay. We want to encourage these kids to have a positive attitude towards learning. We want to read to them every day to encourage that positive attitude. And then we're starting to have kids socialize with other kids. Okay. So pre-operational, this goes from age 2, so a part of toddlerhood, to age 7. Okay. Those pre-conceptual phases are from age 2 to 4. Initiative thought phase is 4 to 7. So we're shifting from egocentric, so self-centered toddler, to being socially aware. So kind of realizing that if I say mine, 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 or no, 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 in toddlerhood, as I get older, if I continue doing that, that I'm not probably going to have very many friends. Okay. So they're kind of learning what is socially acceptable. Okay. They're also starting to consider other people's viewpoints. Their language is continuing to develop by toddlerhood, or excuse me, by preschool. They're speaking in full sentences. Most strangers can understand about 75 to 100% of every word that they're saying. If that's not happening, then their speech is delayed and they need to be working with speech therapy. Okay. They're starting to kind of know about time. So like you could tell them, when the sun comes up, we go to school, or when the sun goes down, we go to bed. Things like that. They're kind of aware with time, but as far as actually being aware of time of day, it's not totally understood. Okay. And then magical thinking is often what they're utilizing in preschool age. So they're doing pretend play, and they're coming up with these big, crazy, long stories of unicorns and mermaids and all sorts of things like that. Okay, moral development, pre-conventional or pre-moral level. So they understand punishment and obedience. Okay. They have a very concrete sense of justice and fairness. Okay. So right is right, wrong is wrong. So even if everyone's doing it, they're still, going to think that that is wrong. If they were told it's wrong, it's wrong. Okay. The development of body image in preschool age group, they have very extreme beliefs because they are they have poorly defined body boundaries. So if they, scrape their knee and they start bleeding, they think, they're going to bleed all of their blood out. Or if they, get a cut on their belly, their whole insides are going to come out, is what they think. So it can be very dramatic, especially if they're injured or they need, a Band-Aid for the teeniest little, you don't even see blood, but they need a Band-Aid. Okay. And these intrusive experiences, so if they do get a cut and they think that, all their blood's going to come out or their insides are going to come out, it's very frightening to them. So they're very scared in these situations as well. Okay. They also start to understand desirable appearances. So people who are kids who look more friendly, or things like that. Toddlers may also, preschoolers may also want to start kind of dressing that way. Okay. They're starting to be aware of racial identity differences in appearances and then potential biases too during preschool. Spiritual development, so a knowledge of faith and religion, is learned significantly from others. So if parents are religious or have some religious practices and they're taking these kids to preschool kids to church with them or to their faith-based practice, then it's more likely that these preschoolers will be more aware of kind of spiritual development. Okay. Preschoolers, I said they're pretty literal, right? So they may think that if they get sick, it may be a punishment for, doing something that was against, their higher power. So, they got sick because they told a lie to their parent, and, that's against their God's recommendations or something. And so that's why they got sick. and that's their punishment, is kind of what they're thinking. Okay. And development of consciousness is strongly linked to spiritual development. So if kids aren't really aware of their conscience, so right from wrong, or wrong is wrong, or wrong from right hasn't started to develop, it's harder for them to develop a spiritual development, or a spiritual awareness, I guess I should say. Development of sexuality. In preschool age, they start to have a strong attachment with the opposite sex parent, okay? But they're identifying with the same sex parent. So if dad goes to work in an office like this picture, this son is going to pretend like he's going to work, but he's going to be closer to his mom with attachment wise. Whereas this little girl looks like she's taking care of an animal or a baby, wearing high heels and dressing up nice, maybe like how her mom dresses. But she's going to be closer to dad attachment wise. Okay. Modesty becomes a concern. So they want their privacy in the bathroom, and they should be allowed that. Okay. And like I said, dressing up like mommy or dressing up like daddy. We might see more sexual exploration in the form of masturbation, or kind of exploring those areas. Okay. Totally normal development for that to be happening during preschool age. Okay. But you have to also use your judgment about that too, because there are some cases where kids are being abused, and that's why the sexual exploration is happening. Okay. So having those conversations with parents about making sure that they're having conversations about, our private and not for everyone to see. And using correct anatomical terms for those areas as well. And then you'll start to see questions about, how babies are born from age 3 to 5. Okay. Social development, so separation. The individualization process is completed. So they realize that they are totally separate from their parents and from their family. They're their own person. So that should be completed by preschool age. So by 5 years of age. Stranger anxiety and fear from separation are no longer typically an issue. Okay. By the end of preschool age. Parental security and guidance are still very much needed. They need their parents for guidance and to be good examples, and to have rules and routines for them. Okay. Security is derived from familiar objects. So being aware of the schedule, being aware of, what's going on at home, or what usually happens at home, is secure, helps them to be secure. Play therapy is beneficial if kids are having a lot of fears, anxieties, or a lot of fantasies. Okay. Or if there's concern for abuse, play therapy is really helpful. Language is continuing to become more sophisticated. Okay. Language is the major mode of communication and social interaction between these other preschoolers. Vocabulary increases a huge amount from age 2 to age 5, so through preschool age, through the end of toddlerhood into preschool. And we're becoming, kids are starting to have more complex languages. So they might start using, some more complex words. Personal social, so they're still very much ritualistic. They're still having some negativism, but that's starting to diminish over the preschool age period. Kids are dressing themselves. They're willing to please, so they want to do well. They want to have their parents recognize, that they dressed themselves and got themselves ready for the day. Starting to identify their internal values and their standards of the family and their cultural environment. So they're starting to kind of know right from wrong, or the family's code of conduct may be being challenged to see what sort of boundaries can be broken. Play, associative play. So this is group play without rules. So they're just kind of all playing together. but they don't necessarily have the same rules or same idea in mind. Okay. Imitative play still. So we're still, imitating what we see at home. Imaginative play. So imaginary friends start to happen in this age group, 3 to 5-year-olds. Totally normal. Dramatic play. We're listening to our little teddy bear pretending to be, a nurse or a doctor. So we're kind of being more dramatic with our play. And then mutual play, we're playing with other people instead of playing parallel to each other. Fears, oftentimes fears of the dark, animals, ghosts. They may, like I said, they may fear as they're starting, or if we have delayed toilet training, it may be there's some fear of separating with their stool or with their urine, thinking that that's theirs, so they may not want to do that. And then objects or people may be associated with pain. So certain objects, if they saw something on TV, they may then associate that with pain as well. So sex education, find out what children know and what they think. Okay. This information then helps them to kind of know what this information then helps you to know what the child wants to know. So instead of giving them a lot of information that maybe they don't necessarily need, by asking them what they're aware of, then you can kind of guide where they're at already. Be honest with these kids. Like I said, use the anatomic words. That way, in case something happens and they're sexually assaulted or being sexually abused, they can say the anatomic words in a deposition or, in a police report. Masturbation is very common and typically peaks around 4 years of age. We're exploring our bodies. Okay. Totally normal, but make sure you tell parents to tell their children that that's happening in private. Okay. There's another list of their fears. So coping with concerns related to speech and to normal growth and development. So this is speech, really critical period between age 2 to 4. And so if we're not mastering these sensory motor integrations like speech, then we may start to see stuttering or stammering. And so the earlier you can intervene, the better. So a lot of times states have local public health people that can kind of help direct these kids and screen these kids and then get them into speech therapy. Or they may have a mandatory preschool that they have to be in because their speech development is delayed to work with a speech therapist. Sleep and activity, sleep problems. Like I said, it's more common that nightmares, sleep terrors, things like that start to continue into the preschool age group kids, kind of starts in toddlerhood and continues potentially. So encouraging consistent bedtime rituals and slowing down kids' activities before bedtime. So not allowing them to be on screens, watching TV, things like that, doing stimulating things before we're going to bed. It's going to be hard to go to sleep if we're doing those stimulating things right up until bedtime. Okay. Injury prevention. So like I said, motor vehicle accidents, probably the most risky, but as preschoolers become more explorative and they're, riding bicycles or tricycles or jumping on trampolines, having those protective kind of equipments, or roller skating. Okay. So having helmets, knee pads, elbow pads, wrist guards, things like that while they're doing these activities. Okay, seatbelts, right car seats. Okay, so child care shifts from protection to education. So The child care providers aren't necessarily there only to provide direct supervision so these kids aren't injuring themselves. They're also starting to help them learn things as well. So verbal warnings of how to avoid danger, and kids start questioning these. Parents may have taught them something else previously, and kids will remember that and ask. Okay. They prefer companionship of peers, so they want a lot of friends at school during preschool. Parents might not be as cool as their friends at school. Okay. And then children start entering school. Communicable diseases, like I said, they are going to have most all of their vaccines by age, by preschool. And then by age 4 and 5, before we go into kindergarten, we kind of get the last boosters of our childhood vaccines. So there's a lot of coverage from infancy to preschool age group for communicable diseases. But like I said, with the decline in immunization status across the US, there has been a resurgence of some of these communicable diseases. Okay. So assessing for exposures, monitoring for symptoms, reviewing their vaccine history or history of having that disease or illness. Those are all things that you're going to have to do nursing care wise, and assessing that patient if they're in the hospital. Okay. Obviously preventing spread, hand hygiene in the hospital setting, making sure you're not carrying, taking one gown and glove to another patient room if they had an infectious disease. Okay. And infection control policies, following those. But your primary prevention of disease is immunization. Okay. Conjunctivitis, so pink eye. You're going to tell parents to keep the area clean, to wipe with warm washcloth, and apply warm, moist compress. They're going to also have eye drops, okay, typically antibiotic eye drops. There is viral and allergic conjunctivitis that happens as well, but sometimes it's difficult to discern those or to try and identify which is which. So a lot of times kids will have eye drops. Stomatitis. So this is the little wounds kind of through the GI tract. It's going to be pain relief. Okay, so making sure that these kids, their little ulcerations are managed by pain, so Tylenol or ibuprofen. Sometimes magic mouthwash is given too. And then obviously preventing the spread of infection by hand washing and limiting contact with saliva and such. Intestinal management. Hang on, I have a question here. Okay. So parasitic infections, Giardia. So making sure that these kids get fluids because they're going to have significant diarrhea and vomiting. Okay. But you want them to flush that from their system. They may also get an antiparasitic. Enterobasis, so pinworms. If you have kiddos with anal itching, that's probably the most likely reason is pinworms. One way you can diagnose pinworms is by telling parents to put a piece of Scotch tape over the anus entrance and before the kiddo goes to bed, and then in the morning, what will happen is those pinworms will be stuck to the Scotch tape. They can take that into their provider's office and show them. And they're little teeny tiny white worms usually. And then they'll be given a bendazole or mebendazole, so an antiparasitic. Also encouraging hand washing, because what happens is they play in the dirt or whatever, and they get the pinworms under their nails, and then they bite on their nails, and then that's typically how they get pinworms or Giardia too. They're not washing hands very well. Child neglect. There's physical neglect, there's emotional neglect, and then there's sexual abuse or emotional abuse. Okay. So physical neglect is depriving of food, shelter, medical care, education. Emotional neglect is a lack of nurturing, or attention or affection. And emotional abuse or psychological maltreatment is, purposefully destroying that child's self-esteem. Physical abuse, obviously, head trauma is probably the most common, from shaking baby syndrome. Munchausen's by proxy is a belief that child is sick all the time, so you can continue to seek care for fake medical reasons. Factors predisposing abuse, so parental characteristics, so parents maybe were abused themselves, or they have mental health conditions that are undiagnosed or unmanaged. Children who have more difficult personalities are more likely to be abused. More fussy babies are more likely to be abused. And then some environmental characteristics. So, they're in an environment with a lot of other people in their home that maybe aren't their family, that may increase their risk factor as well. Or they're going to daycares and things like that. Physical assessment's going to be key in an abuse situation. Also making sure that child is protected from further abuse. They're feeling supportive. You're supporting the child and the family if it's not family who's abusing them. And they're in the hospital setting or they're getting ready to be discharged. Usually Child Protective Services or CPS or DHS, whatever you call them in your area, they're going to come in to the hospital setting or the clinic setting and do an assessment of that child's family situation. If there's a major concern, though, police will be involved as well. Okay. Parents tell the nurse their 3-year-old daughter and a male cousin of the same age have been inspecting each other closely when they use the bathroom. Which of the following is the most appropriate response by the nurse?
B.
Okay. Yes. B would be the correct answer. I don't know if anyone else had any other thoughts, but B is correct. Okay. But you also want to let them know that these areas are also private. Okay. As they're getting older and that they're not showing everybody their private areas. Okay. But you don't want to punish. Okay. We don't have time for cahoots. Sorry. That was a lot of material thrown at you guys. Okay, and my internet just froze, so sorry. Okay. Does anyone have questions, concerns, thoughts? You guys will have a quiz again next week. It's over this week's material. Anything?
So do we not go over the quizzes?
I do not go over the quizzes. I kind of just touch on questions that were the most struggle, which, like I said, that was the cultural, making sure you're adapting to cultural situations that you may encounter as a nurse, but it's not necessarily the case that all cultural things are allowed in hospital settings, right? If that makes sense. So there might be some things that they do in certain cultures that, are unsafe to do in the hospital setting. But we still want to be respectful and allow them to do as much as they can. Okay. So that was kind of the biggest struggle question, but no, we do not unfortunately go over the specific quiz answers.
Our first exam for this class is week 4, correct?
Correct. July 28th.
Is there a review, exam review that you typically do?
So we will all do exam reviews week 3. That schedule should be posted towards the end of this week. I'll know what all the other instructors are going to be doing. I usually do my exam review right before class, week 3. So next week I will do a review right before class. And it will just be in the same Zoom link, and I'll record it, and all the other professors will record their reviews, and I will post them all in an announcement with all the exam 1 materials. Okay?
Okay, thank you.
Mm-hmm. If you guys want to meet with me for some reason, or you have questions or what have you, just email me. I'm pretty good about emailing back. I do have a full-time job and 2 kiddos. So I can be a little bit busy, but I usually try to get back to you as soon as I can. And the Canvas messages and emails come right to my phone. So, okay. I might say I'm at work and I can't get that information for you right now, but I'll get it as soon as I get home for you. Okay. And if there's something going on in your life that's affecting schoolwork or what have you, and we're struggling, then it's a lot better to let me know as soon as we're starting to struggle until we're, into week 7, 8, 9, and we're really, really struggling. Okay. But like I said, make sure you're reading your book. That's how you guys are going to be successful with this course. Okay. Anything else? No? Alrighty, you guys have a good day. I'll see you all next week. If you need anything before then, let me know. Bye.